From Friday night lights to the soccer field, fall volleyball, and more, any opportunity for middle schoolers and high schoolers to be part of team sports may prove to be invaluable.
Any team, any physical sports, any team sports is great for adolescent mental health, especially when it comes to suicidal ideation.
And not just one team sport.
One is protective, but two or more has an additional benefit.
Massy Mutumba is an assistant professor at the School of Public Health at Washington University in St. Louis.
Our interest was mostly looking at CDC data that shows an increase in suicidal ideation among adolescents who are younger.
Mutumba's recently published analysis spans more than 800,000 students in the United States. Mutumba says playing on two or more different team sports of different types of sports is a shield against suicide risk in teens and preteens. The middle and high school students participating on two or more different sports teams are significantly less likely to report suicidal thoughts or behaviors, even as youth suicide rates have climbed at an alarming rate.
Two or more sports, whether you're in middle school or high school, is more beneficial than definitely not doing anything. Even for those who are just doing physical activity, which is recommended like 6 days a week, you still get some benefits, but it's not as big as what you get from team sports.
Suicide is the second leading cause of death for kids ages 10 to 14, and it's the third leading cause of death ages 15 to 24. Creating a serious public health crisis.
Data suggests is that it can begin even as early as 6. You see children as early as 6 beginning to manifest the symptoms, including thoughts around suicidal ideation. So the goal was our interest in finding what can we do. What sort of interventions can we do to address suicide risk?
Mutumba completed the sports participation analysis alongside her co-authors while at the University of Michigan before joining the School of Public Health at WashU. The school is new. It's WashU's first new school in 100 years, and it's located in the Cortex Innovation District in St. Louis. The goal of the new School of Public Health is to meet the current and future challenges in public health in St. Louis and globally.
One of the key motivations was to do my work on suicide among children in St. Louis area. It's kind of hard to do that from a distance. We were going to work initially with a focus on youth of color because, the rates of suicide are increasing exponentially within these groups compared to other groups.
And so her work in St. Louis begins. And with it, her message about the benefits of team sports.
It's self-esteem that you're going to get. It's the skills, overcoming adversity. You lose, you win, you learn to manage that, right? But it's also the social connections. You're with friends, right? Thinking about when you're experiencing adversities, now you have this connection that could work. A lot of these skills are transferable. What they are learning within sports doesn't remain within sports. Again, it's something that is building their character and helping them overcome this adversity. But for us, what we really speculate, it's these social relationships that they're building, the connections that they're building that are very beneficial.
Mutumba's good news faces a problem. Her analysis also found that sports participation has declined.
Starting from 2017, really to look at what the trends were. So you see a much bigger drop among middle school students participating in sports.
She says youth sports needs to be accessible and scalable.
Schools used to be the places where kids got into sports. You had all these sports programs in schools. Funding, a lot of that has been eroded. So that erosion of school-based sports program, I think, is a big contributor. You see fewer sports, especially at middle school. Definitely even elementary school settings, that has gone out. By high school, students have already been set. It's very difficult to get into sports in high school. If you have a younger child and you want them to participate in sports, you have to pay. And most often you're working with an entity outside the school setting for them to be able to participate in that.
She recommends a sustainable public health strategy. Maybe now a new approach to the power of sports will be in the playbook.
That would allow us to then use that as the foundations for building a program that would then really emphasize sports as a mechanism of addressing suicidal behaviors.